Hello, Pain Free for Life members. Dr. Rob Van Bergen here for another Monday 10-minute training. This is our video series where I try and cover a microcurrent topic and treatment and kind of cram it all into a condensed learning process that's completely covered in under 10 minutes. Most of the time, I hit my goal and make it. Sometimes we go over. But regardless, these micro trainings have become very, very popular with the community because they're easy ways to just watch once a week and learn something new. So today I'm going to talk about a topic that's often uncomfortable for many women, and that is urinary incontinence. Now, urinary incontinence is something that I receive multiple requests for a protocol for every single week. And I thought I would just put it out there and share the information, save me and people some time, and just get it all out there, right? It's something that people don't want to talk about publicly. It's not something they ask on pages. It's something that I get a lot of private messages about. So urinary incontinence, for those who don't know, is the loss of bladder control. And it's a common and often embarrassing problem more than anything else. And the severity ranges from kind of occasionally leaking urine when you cough or sneeze to having an urge to urinate that comes on so sudden and strong that you can't hold it in long enough, and it just comes out. So though it occurs more often as people get older and has become kind of associated as an inevitable consequence of age, urinary incontinence, like most medical conditions, is not an inevitable consequence of aging. It's not something that you should expect that is definitely going to happen to you. And most of the time, it can be helped. So the symptoms can be brought on or worsened by a decline in muscle strength within the bladder. This is typically what we see, is most of the time muscle strength is being impacted as a result of childbirth or pregnancy, or just and I mean, I know I just mentioned it's not a consequence of age, but the truth is it is. There is that weakening of the muscle in the bladder that can happen from age. But it's one of those situations where if you don't use it, you lose it kind of thing. That's how it works with muscles, right? We exercise the muscles. So a lot of people will do Kegel exercises and things like that to kind of strengthen the muscles. But even if you haven't done that, even if that's not helping for you, the good news is that there is a simple microcurrent treatment that can strengthen and repair these muscles from the inside. So how do we do that? Well, the optimum treatment method here is to make use of the vaginal electrode, which we sell in the Santa shop. This is an insertable electrode that can help to strengthen and repair the pelvic floor muscles. So this has been used for things like prolapse, for dealing with internal scarring, and so on. But by far the most common use for it is for helping strengthen those pelvic floor muscles as a result of working towards resolving urinary incontinence. So depending on your device, you're going to have different capabilities. For the genesis and the evolution, the use of the 121 hertz program is going to be the best choice. But you need to follow it up with 7 to 12 hertz. Okay, so there's a combination treatment that has to be done to make this work. Because if you don't combine those frequencies, you're not getting what you really, really need out of this. So the modulation in 121 hertz is what we're going for. This is not an inflammatory issue. We're not looking to resolve inflammation at all. What we're looking to do is we're looking to exercise the muscles. And so when you use a modulating frequency like 121 hertz, you get 3 seconds on and 1 second off. So it's 3 seconds of strength on it, a pressure, and then a release, and then 3, and then a release. And that's what you're going to be achieving there. But the 7 to 12 hertz helps to actually repair muscles. And so you're going to be helping to use that to get some regeneration in. So you've strengthened the muscles and you're regenerating it. So the recommended daily treatment times for this, I know everyone always asks me, would be 5 minutes with 121 hertz and then 3 minutes of 7 to 12 hertz. And the 7 to 12 hertz portion helps to stimulate muscle repair, right? So we're exercising and encouraging repair. If you have the Pinnacle, you can run eStim T1. So this is eStim Tier 1. And you work your way through the different e-stims every 3 to 4 weeks if you're treating once a week in a clinical setting, or after a week if you're treating daily until all the e-stims have been used. So this is an exercise program and it's pretty intense, but it will help strengthen the pelvic floor muscles to reduce the frequency of urinary incontinence and help to slow or even stop further progression of any prolapses as well. Now, you want to judge treatment time here based on comfort, but I like to encourage up to 10 to 20 minutes here. But bear in mind, this is a workout for your muscles. Do not push it if your muscles start to ache, because you don't want to end up being so exhausted and tired in your bladder muscles that you end up worsening the incontinence. So if after 3 minutes of e-stim T1, you're thinking, okay, I'm feeling tired, I feel like I've had a workout, stop. You need to build that up. Just like you wouldn't push yourself while lifting weights, don't push yourself with the exercise programs either, okay? So judge it based on comfort, eventually aiming to get up to 10 to 20 minutes of exercise on that muscle. This is a repair and exercise program, so it's doing a lot of things. Just don't push it beyond, give it time to rest. Now, eventually, as I say, you want to move up through the e-stims. So if you find that your e-stim T1, which is your first stage, is too strong, you move to T2 after a week, which is what we recommend. But you find that even like 30 seconds in, you're like, this is too intense. It's okay to back up to e-stim T1. You wouldn't throw on another 30 pounds of weight and say, I'm great because I've been doing this for a week. You would do it to your body's capabilities. You want to try and go for longer e-stim T1s rather than being reduced to 30 seconds of e-stim T2. You're going to have to build it up gradually. These exercise programs are very strong. They are made to work in a physio setting. They can help to deal with people that have atrophying muscles because they're actually working to build up and repair the muscles there. So you need to make sure you're using them in a staggered, tiered way and listen to what your body is telling you, okay? Start with short treatments on T1, work your way up to short treatments on T2, and so on. Eventually, you should be able to get to the point where you're able to actually use the top mode for 10 to 20 minutes a day, and you won't have any problems with it. But allow your body the gradual time it needs to get there, okay? So with these exercises and using these exercises, we are finding that people are able to eliminate the incontinence problems that plague them on a day-to-day basis. And this can be regardless of how long you've been struggling. One thing I didn't mention in either of these protocols, which I'll throw in as a bit of a bonus here, is if there's ever been any surgery or you've ever had a child, gone through childbirth, there is the potential for scar tissue. This could be hampering things here. So using the same vaginal electrode and using 77 hertz or the Blue Rel 77 or even the Sana Deep 77 to get the frequency in there and neutralize scar tissue is optimal. And I would suggest doing that before you do the other treatments. If you've never had a child before, then you're like, oh, you've never had surgery in that area, you're likely not going to have the same scarring issues, but it doesn't hurt to give it a try. A 3-minute treatment of scar tissue can make a big difference for so many different conditions. So if you are interested in the vaginal electrode, I have included a link in the description below. I know people are probably not going to ask for it in the comments, so I just wanted to include it there. And if you have any questions about this or anything else, please don't hesitate to ask, okay? And I will see you all next week. Look, I made it in under 10 minutes for another Monday 10-minute training. Have a great week, everyone. See you next week.